I'm Dr. Bernard Starr, the current president of ASP, that's the Association for Spirituality and Psychotherapy. And you can find out all about us at our website, which is, what is our website? Right, www.psychospiritualtherapy.org. And tonight we have a very exciting subject that we're going to be exploring, and an outstanding speaker. The subject for today is spirituality and infertility. And to introduce our main guest, I'm going to invite up here in a few minutes Alita St. James, but let me tell you something about her first. Alita, who actually is a board member of our association, is also an emotional healer, and as well has done many other types of healing, and also has her book, this very exciting book, called Life Shift, Let Go, and Live Your Dream. I mean, isn't that a great title? Let Go and Live Your Dream. And Alita has also been on almost every major talk show in the country. She has also been named by AARP as one of the most inspiring people. And she made world headlines in 2004 when, at age 57, she gave birth to twins. So Alita knows a great deal about fertility and also about dream making, which is one of her fortes. So Alita, why don't you come up here and introduce our guest for tonight, and you might want to say a few more things about yourself.
Mm-hmm. Thank you so much. I'm very excited to be here, especially with Helen Adrienne, because both of us are very dedicated in terms of helping women become pregnant that are infertile. My grandmother gave birth to my mother at 54, so I always thought in my life that this was going to be an easy shoo-in. And by the time I was 49, I thought, well, maybe I should get started on this journey. And what I experienced, even though I had done a lot of energy work for 35 years with myself and in practice, helping many women become pregnant, either when they were in their 40s or when they were having a difficult time, when it came to me, I had 3 miscarriages because I was trying to do it naturally. And I started to realize that I was going to have to actually go into the IVF route. So at 54, I jumped in and I began to really go through that journey. And it was a roller coaster, even for me, of tremendous challenges in terms of keeping the faith, releasing the fears that would come up or the self-doubts along the way. I'm very, very blessed because I've been able to use energy work with healing with light and sound and breath and allowing myself to hook up to the higher spiritual dimensions to bring in to the physical body an actual molecular change on a cellular level. But even through that, I found that there were certain things that I had to be able to overcome emotionally when I had the miscarriages, when the first IVF didn't work, and I had to go back in and have all the trust and faith and belief to be able to go through, to keep on keeping on, and know that failure was not an option. So for me, going through this journey, and people would say to me, how could you expect to have children at 57? I mean, aren't you being selfish? And I said, I think motherhood is one of the most magnanimous things I can imagine ever doing. And now that my twins are 4.5, I can attest to that fact because there's no me anymore. It's them. And everything revolves around them, and gladly so. And I think that's one of the things when you're an older parent, is that I've done everything that I wanted in my life. I had the lead in the Amsterdam production of Hair. I had a rock band. I directed, I sang, I wrote. I became an emotional healer and a success coach, and I kind of traveled all over the world, swam with the dolphins, and went to India and Peru and climbed Machu Picchu. And then I got to a point where I thought, you know what? I'm really ready to just give all the love and wisdom that I can to my children. And every single day I look at them and they're a blessing. And I think, what would it have been like had I not gone that route and had these beautiful children, and it wouldn't have been wonderful at all. I would have missed out on a big section of my life. So for my work and for Helen's work this evening, and she's going to present to you tools and things that you can use so that when you're on this journey and you really need to keep on keeping on and you need to keep the faith and release the emotional turmoil that goes with it and feel positive, she'll give you those tools from her perspective in terms of how you can get your mind and body and your spirit aligned with success of having children. And so that's why it brings me great joy to be able to introduce Helen Adrienne this evening. I want to give you a little background of this wonderful person who's going to share with you all her magic this evening. Helen Adrienne has been in private practice since 1979. Although a general therapist, she has specialized in emotional component of gynecological and reproductive care, especially infertility. She works with individuals, couples, and mind-body stress reduction groups for infertile women. She's now running these groups for the wellness program at the NYU Fertility Center. Helen is licensed in New York and New Jersey and is a board-certified diplomat in clinical social work. She was trained in mind-body therapy at Harvard's Mind-Body Institute and was trained in clinical hypnosis at the New York Society for Ericksonian Psychotherapy and Hypnosis, where she now teaches. She is an approved consultant for the American Society of Clinical Hypnosis. Helen has been published in Conceive and Family Building magazines and on the infertility website Inside. Her articles can be found on her website, helenadrienne.com, where you can also find archives of her newsletter. You can also sign up to receive her newsletter on her website. Stay tuned for the news that the book she has written on infertility is on its way to be published. Helen is a charter member of the New York City chapter of Resolve, a national organization which provides information, advocacy, and support to infertile patients. She has presented many times at Resolve's conferences. She has presented to colleagues at various national organizations on the profile and treatment of infertility and to infertile patients about effective management of the emotional experiences of infertility. Helen also colors her hair and flosses regularly. May I now present Helen Adrienne. You're welcome. Okay, is that yours? Oh, no. Okay, that's yours.
Well, Alita just set me up perfectly to be an advocate for the infertile population. These are people who suffer greatly, and even though Alita came at this at an age where she had lived her life so fully as you described, women who are in their 20s or 30s say the same thing that you say, which is, oh, I worked so hard to get these children. I can't imagine life without them. But in the process, there's an enormous amount of suffering that takes place. You know, if you think about everybody is born, they grow up, they pay taxes, they reproduce, and they die. And the one thing that's the best of all, nature says, too bad for you. It's an existential blow. And what I'm going to do here is talk about the overview of infertility before I get into, for this audience, the spiritual component. For the larger audience, you certainly can take what I say in terms of the overview, and you can take what I'm going to teach tonight, which are ways to work with people who are suffering with this, and make it your own. So first of all, 1 in 6 couples is struggling with infertility. That's 7.3 million men and women in the United States alone. And when I started in 1979, the percentages were closer to 15%. Now they're inching toward 20%, and a lot of the reason has to do with waiting when fertility levels have dropped. And that easy conception, you know, my mother had me at 39 or whatever. So there's an expectation that there won't be a problem. And then there is. Fortunately, modern medicine has produced some incredible miracles, but at a cost, because the treatment is a full-time job. It's really quite demanding. This is something that women go to bed with at night and wake up with in the morning. And the level of stress has been measured to be on a par with a diagnosis of cancer or HIV/AIDS. So people respond to this as if it were a terminal illness. The figures on it are 35% male factor, surprise, surprise, 35% female factor, 20% combination, and the hardest of all is 10% unexplained. Right? The women who don't have a diagnosis are, you know, they're tearing their hair out because they, you know, when there's a diagnosis, often there's a specific treatment. This is a bio, psycho, socio-spiritual crisis. It's around the mulberry bush. No area of life is untouched. And unlike certain crises, which have an acute phase, 6 to 8 weeks, and then things settle down, this is an endurance test. It can take years before it gets resolved, and it's endless. Wherever you turn, there is some aspect of your life that's unrecognizable. The unknown looms large. And so basically, this is a very profound mind-body experience. And so the solutions have to be mind-body solutions in order for people to get relief. The word fear and the word anxiety are very close to one another. And certainly, fear, anxiety and depression are normal in this population. The DSM-4, which is the measure of personalities and traits, come out absolutely normal for most women who are struggling with infertility. But still, you are tossed into a place where you're in this anxious and depressed place. Then you walk in for treatment. Now listen to these words. These are some of the names of some of the treatments. Intracytoplasmic sperm injection, right? Sperm DNA integrity assay, right? Pre-implantation genetic diagnosis, co-culture, donor insemination, ovum or sperm donation, selective reduction, embryo donation, surrogacy, comparative genomic hybridization, right? So the language that you're faced with and the demands, the drugs, people, you know, have drugs, the names are this long. And the interesting thing about fertility patients that I have enjoyed with them is that by the time they're into the process and moving along and searching the internet and reading everything that was ever printed on infertility, I joke with them that they are all but their boards in reproductive endocrinology. This is a very well-educated group. And so as practitioners, you have to be aware of just how on top of things people are, with the understanding that what they're not necessarily on top of is how to manage themselves. And that's where our work as clinicians come in. Okay, in terms of the biological component, biopsycho, socio-spiritual, the biological, there's a feeling that the body is defective and has betrayed them. The diagnosis and treatment renders the privacy of lovemaking null and void. And in fact, lovemaking becomes baby-making. Modesty has to fly out the window, and think about if there's been any kind of abuse in the background, what that would do when your private parts are exposed to fluorescent lights. Right? The drugs themselves create an emotional lability. Women call it PMS on steroids. One of the first questions I ask people who come in is, has your doctor warned you what these drugs can create within you? And I'm amazed still that sometimes the answer is no. So then they're running around blaming themselves, right, for, basically feeling like they're swinging from trees. As I said before, the treatment is so demanding, it's like a second job. And put all of this now in a medical setting, which is treacherous for some people based on their history. I don't have to tell you, insurance makes Bedlam look good. And of course, it creates financial anxiety because the one IVF treatment averages about $15,000, right? And women have as many as they need. You heard Alita's determination. There is no is not an acceptable answer. The body feeds into the mind-body connection. So anything that's biological is going to have a psychological component. So just the idea of going from lovemaking to baby-making and the loss of privacy, the depression and anxiety at not being able to get to your goal. And often people are very high-powered. They've decided they're going to get a law degree. Then they decide they're going to be partner. And then this is the first time that they're faced with, too bad for you. And then there's a death every 28 days, right, with the attendant grief, because this is what menstruation does when you're longing to be pregnant and you're not. The primary feeling is a feeling of being out of control, and the mind-body techniques, some of which I'll teach you tonight, put people back in control, not of the circumstances, but of how they deal with them. Self-esteem gets shot to smithereens. The reproductive area is highly charged for men as well as women. I've never met a man who's been happy, or shall we say excited, pardon the pun, to ejaculate into a cup, right? Nor does any man or woman sign up for this brand of sexuality when they get married. They don't expect to be looking at the calendar and being upset about what's wrong with me, this, before the diagnosis. And then sex is rendered irrelevant in some instances, certainly with in vitro fertilization. The impact on the marriage in terms of coming to terms with a problem in him is my problem, a problem in me is his problem. And all of the dust needing to settle in all of the aspects of the marriage that get called into question. Sociologically, women are looking at babies wherever they turn, and it's very painful. Friends and family often are well-meaning, but you wouldn't believe some of what flies out of people's mouths. That is really hurtful. And the big thing is you've already lost privacy. You're in a medical setting. People are powwowing on what they can do for you, right? And now the tension builds up. It's incredibly intense. And what do you do with the tension? Well, what we do with tension when we're upset is we talk to friends, right? Do you want to let people into the inner sanctum of your marriage? If you do, who? What if you let in somebody who doesn't handle it well? your parents, when are we going to be grandparents? And, you know, do you tell them, don't you tell them? Do you tell your boss, don't you tell your boss? The privacy secrecy issue is an ordeal. As far as the spiritual piece of it is concerned, there is a sense sometimes of being punished if I hadn't had that abortion. If I hadn't, and it goes all the way from something that has a logic to it, to if I had only folded the laundry when my mother told me to. Completely irrational. How many times have I heard the word, what am I, Job? Right? The sense of why me? How do you understand this? What is this all about? Will this ever get resolved? That's a big one, worrying that the outcome will be negative. And I just want to say for anybody who might be listening to this program that in my experience, anyone who is hell-bent on getting a family gets one, right? There are so many options. All of those gibberish words that I read to you before, like intracytoplasmic sperm injection, is affectionately called ICSI. And what they can do is they can take your ovum, drill a hole in it, and put a sperm that doesn't swim so great right in there, create fertilization. Like, what the heck? You know, it's just like science fiction, but still wonderful science fiction. So I would just recommend that you think positively about the potential to have the family that you want to have. Okay. So I didn't know if there was PowerPoint possibility here or not. So I just printed out this. It's part of my PowerPoint slide. And I'd like you to see it. It's basically an aerial view from space of a hurricane. And the vortex that you see in the center is the eye of the storm. Now, the one thing that you can't really tell from this about the eye of the storm is that the sun shines through. And when I was a child, about 10 years old, I was in a summer cottage place, and there was a ferocious hurricane, gale force winds and torrential rain, and then the sun came out. So, of course, all of the children wanted to go swimming, and we said, no, you can't go swimming. This is just the eye of the storm. Do you care about this when you're 10? So everybody carried on, and we were allowed to go swimming with the understanding that we must come back as soon as we're called, because the hurricane isn't over, right? And sure enough, here came the rest of the storm. Now, in nature, the eye of the storm happens. Infertility is a hurricane. And you need to be alert to listening to your patients and encouraging them to find where their pleasure lies so that they can create an eye in the storm. Because if they don't, it's drudgery 24/7. Right, this is what's on everyone's mind, and they have to create a break from it. It's sort of like climbing Mount Everest. There are way stations. You can't do it in one, without taking a rest. The other thing that I like to frame the fertility discussion with is not only is there a need for the I in the storm, but the I, the self, gets lost. And so helping people re-find who they were or not lose who they are in the process. Now, at the risk of mixing metaphors, I have another slide which is of a campfire. Right? And the reason that I have the campfire in the mix is because this is an age of multitasking. Everybody is overextended, running here, there, everywhere. And then when you add infertility to this, and they have a full-time job, it's unbelievable. Whereas phylogenetically, our ancestors heard a twig snap right? It could have been a chipmunk, and it could have been a saber-toothed tiger. So they mobilized the fight, flight, freeze, syndrome. They mobilized to fight or flee. But then, at night, they sat around the campfire and they did all of the things that reverse the physiology of stress. Drumming, singing, dancing, storytelling. Right? Brings all of the elevated heart rate, elevated blood pressure, muscle tension, breathing rate. It brings it all down. And so if you think about about infertility as provoking the fight-flight syndrome, then it is our job to teach people how to reverse the physiology of stress. And Alita mentioned that I'm doing mind-body stress reduction groups at the NYU Fertility Clinic, and the program is really very comprehensive. I teach something that I will teach you that is specific for dealing with the physiology of stress, so that they can experience the mind-body connection, learn about the neurobiology of mind-body healing. I'm exposing them to coping skills that they wouldn't have thought of on their own necessarily. We work with enhancing self-esteem and getting at automatic negative thoughts and underlying belief systems, creating affirmations, working with emotions, learning about how you communicate and if you're assertive enough to get your needs met, and incorporate humor. Laughter is the best medicine. So it's really what Herbert Benson up at Harvard called the model of the three-legged stool. This is the model for overall health. And two legs of the stool, the one that's on your left and the one that's in the middle, read pharmaceuticals and surgery. Right? The third leg of the stool is self-care. And Benson makes a point of how much of people who come in for doctor visits are coming in for something that really falls in the category of self-care. So there they are saying, do something about my emphysema, and the real concern is, why did you spend 35 years smoking, right? You were not taking care of yourself, right? So after the fact, modern medicine has, ways of treating symptoms, but this is a way of teaching people whose lives have gone out of control ways of getting, returning their physiology to neutral and feeling the empowerment that goes along with that, right? And so that's where the feeling of out of control gets flipped. And also going into a place that allows people who are dealing with a frenzied lifestyle and frenzied circumstances and have millions of questions to answer. Well, you've had a retrieval. That means that your body, your ovaries have been super ovulated, and at the right time they're withdrawn and put in a petri dish with sperm, and they're grown for a couple of days and then they're transferred back, right? And so there's surgery to retrieve the ova. There are pharmaceuticals to prepare the ovary to kick out extra ova. But that doesn't change the fact that women are flying around in the ionosphere, right? And so you want to bring them back into their body, not only for having the maximum receptivity to a pregnancy that they can, but also so that they can think straight, because the doctor could very well say, well, let's see, how many embryos are we going to put in, right? Well, you know from Miss California what happens when you put in too many and how treacherous that is. And yet women who are struggling with infertility are pleased to get an instant family. You know, twins would be great. And yet, if you put in 3, what if they all take? You know? I just had that happen with someone. Okay? So, so coming into that place where you can reverse the physiology of stress and teach people how to access their inner wisdom is a really important gift that you give people. Okay, so here's how I think about interventions with fertility patients. There is an expression, to do is to be, that came from Socrates, right? To be is to do, that came from Plato. Doobie-doobie-doo came from Sinatra. But the do and the be is what I'm trying to illustrate here, that there's plenty to do. The medical people will tell you what to do. You show up at the clinic, you get your blood drawn, 7 o'clock in the morning. You have to make sure you inject yourself the same time every night. What if you have needle phobia? I mean, the complications have complications. What do you do about telling people? Whom do you tell? But how do you be with this? How do you be with, you know, the gestalt of the infertility experience, which, by the way, is what my book is about when it hits the press. And, of course, this group, I'm sure, knows pretty well that to calm the body will calm the mind. So yoga and Tai Chi are all the rage among fertility patients. And calming the mind calms the body. And so when it comes to solutions, I'm going to teach you one that will break the stress cycle. And you want to break the stress cycle by doing 3 things. You want to occupy the conscious mind so that it doesn't go dancing around with, oh my God, what if it doesn't work, right? And you want to tame the autonomic nervous system. You want to bring heart rate and breathing and muscle tension down. And you want to bring people into the present moment. So in terms of spirituality, basically when people are praying, they're going out and they're asking for something. And I certainly encourage that. And I find that people don't necessarily come in asking about it, but if I bring it up, they're happy to talk about it. Because even atheists and agnostics are sitting there with why me, right? But what I'm going to teach you is about going in, right? So first I want to set you up for that, to learn that, by asking you to make a fist and put all of your energy, as much as you can, tighter, 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 tighter. Now what happens to your breathing? It stops. At best, it's shallow. It's from here to here, and all the capillaries, the predominance of capillaries are in the lower part of the lungs. Okay, so now do a little body scan. Just ask yourself how you're feeling physically. Are there any kinks, any place? How are you feeling in terms of centeredness? And now take one, just one, generous inhalation. Okay. Does anybody notice a difference? Can you say? Calming. It's calming. Okay. So now if one breath is calming, and you do the relaxation response for 10 to 20 minutes once or twice a day, there is a phenomenon in the midbrain, right? We have here the brainstem, the cortex, and the structures of the midbrain. The midbrain is the place where we dream from, where the unconscious is said to reside, where we're creative. And it's also the part that does not know that you aren't where you imagine yourself to be, right? So this is why guided visualization is so powerful. But it's also the part that is at the mercy of something called time distortion. Now, you probably know time distortion because you drive from here to the Hamptons and it takes 3 hours, no traffic, let's say, right? You drive home 3 hours, but you say to yourself, how'd we get here so fast, right? So 10 to 20 minutes interpreted by the midbrain really becomes more in the giant scheme of things than 10 to 20 minutes. So you've got infertility patients who are really in a frenzy, and if they can self-care, right, discipline themselves to take care of themselves, then by doing the relaxation response for even this brief period of time, it can make a difference, and the body then begins to crave, like, ooh. You know, at first there may be resistance. That's a whole other story. That's a long story that we don't have time to get into. But certainly, in the best case scenario, the body says, "Wow, I'm not in overdrive anymore. I'm in neutral. This is really cool." Okay, so the relaxation response goes like this: you select something to occupy your mind. Right? Well, before I do that, let me do one more thing. One more thing. Put your hand out. Move it to one side, back to center, to the other side, and back to center. Now, do that in the past. Do it in the future. I'm looking at the faces. We only have the present moment. That's the point. We only have the present moment. So it's occupying the monkey mind, it's utilizing the breath, and it's staying in the present moment that we're going to be doing here. So now, if you select something that's a word, a phrase, or a prayer, right? The word could be rainbow or ocean or peace or love or something like that, something to which you would have a positive association. You say it to yourself every time you exhale. So it looks like this. Peace. Peace. Right? Now, most people enjoy doing this with their eyes closed because it screens out any distractions. Guaranteed you'll lose your place. Let it go. Start again. If you select a phrase or a prayer, you say half to yourself on the inhalation, the other half on the exhalation. So that would be, I am at peace. Over and over. The Lord is my shepherd. Over and over. Right? So I'd like to try it. I'd like to give you a chance to experience this. So if you would select something, and then I will talk you into it. I'll be quiet for a brief period of time, and then I'll talk you out. So, anybody not have a word, phrase, or prayer? Okay. All right, so I'd like you to start with that generous inhalation that I call a cleansing breath, just as a way of separating then from now. That's right. And if you're comfortable with your eyes closed, you can allow them to flutter shut. If not, certainly feel free to keep them open, but let them go a little bit out of focus. And now just rest in the rhythm of your breathing. Don't try to force anything, just notice. Just notice. And there are so many things to be curious about when it comes to breathing. And I'd like you to notice something that perhaps you haven't noticed before. And that is, on the next exhalation, notice that it has a downward movement. And just let the exhale take you down, deeper down, just a bit deeper down, but closer to the center of your being, where all of your wisdom and truth reside. And from this place, begin to say your word, phrase, or prayer over and over, coordinated with your breath. That's right. Easily, gently. That's right.